Founded by Margaret Sanger, Fanny Mendel, and Ethel Byrne on October 16, 1916. They opened their first birth control clinic in Brownsville, Brooklyn, New York. Sanger wrote about this mission herself in 1921. The almost universal demand for practical education in birth control is one of the most helpful signs that the masses themselves today possess a divine spark of regeneration.
In 1979, Title X of the Public Health Service became a law, authorizing the Secretary of Health and Human Services to award grants for projects to provide family planning services to any person desiring such services, with priority given to individuals from low-income families. Federal tax dollars do not pay for abortions. Title X and Medicare are programs that target low to middle-income families, and many of Planned Parenthood patients are otherwise lower income.
Of Planned Parenthood's patients, 83% were 20 or older, according to a Government Accountability Office report that looked at data from 2010 to 2012. Nearly 80% had incomes at or below 150% of the federal poverty level, according to that report.
Some people actually label Planned Parenthood as a place that specializes only in abortions, while others say it increases the federal budget, which actually is a valid argument. However, Planned Parenthood provides Medicare to low-income families and can actually stimulate the economy because, keep in mind, it is the low-income families that are the majority of the country, unfortunately, and as long as they're healthy, our economy will be healthy as well.
Planned Parenthood provides for more than just abortions. Some services include women's health services, men's health services, LGBTQ services, pregnancy tests and services, pelvic exams, patient education and counseling for sexual assault and counseling to new parents, HIV services, birth control, free or low-cost ultrasound, and routine checkups. According to Planned Parenthood, its total services are made up of 42% STD/STI testing and treatment, 34% contraception services, 11% other kinds of women's health treatment, 9% cancer screening and protection, 3% abortion services, and 1% classified as other.
According to CNN, Planned Parenthood provided parental care to 17,419 people, as well as 4.2 million tests and treatments for STDs. There have been 360,000 breast exams, 1.5 million young people were provided sex education by Planned Parenthood. Planned Parenthood say they prevent an estimate of 579,000 of unintended pregnancies per year. There have been only 323,999 abortions performed. There are 660 Planned Parenthood healthcare centers in our nation.
According to the New York Times, the Colorado State Health Department estimated that every dollar spent on the long-acting birth control initiative saved $5.85 for the state's Medicaid program, which covers more than 3/4 of the teen pregnancies and births.
My name is Jennifer Polena, and I was a receptionist for Planned Parenthood of Costa Mesa in 1995 for 3 years. The mission statement of Planned Parenthood? Well, the Planned Parenthood believes in the fundamental right of people regardless of income, race, ethnicity, sexual orientation, age, and residence. If you're legal, illegal, it doesn't matter. They all inclusive to everybody.
The Trump administration recently prohibited Title X funding. How does this affect Planned Parenthood's clinics in aspects other than abortions?
Well, the Title X provision provides money for a lot of low-income people. It was provided in the late 70s. And so it would affect about 4 million people, recipients that get that kind of funding, and it would affect their whole reproductive for abortions and birth control and all the other things that go with it, the STD and all that kind of stuff that we do at Planned Parenthood.
Okay.